Hello everyone, this is Dr. Padmanabha Verma, Consultant Endocrinologist, SLG Hospitals. Today I'll be discussing on what are the common liver problems we see in diabetic patients, how to identify and how to investigate those people and how to treat or how to prevent. The most common finding we see in diabetic patients is the fatty liver. You might have seen in many of the diabetic patients when they get the ultrasound scan done, you see in the reports that grade 1 fatty liver, grade 2 fatty liver. Why it happens? Because whenever you eat excess of calories, first initially deposited in the subcutaneous fat. Once the fat stores are full, then start depositing inside the organs, like in the liver or kidney, surrounding the kidney or around the intestines. This is called visceral adiposity. So like that, the fatty liver starts. Why we should treat? Because most of the fatty livers, how to identify means most of the patients will be asymptomatic. So unless you get the routine scan done, you may not identify the fatty liver, because unless it goes to the very end stage, you won't feel like any symptoms. Like this fatty liver, if you're not treated this fatty liver, then it can progress to the steatohepatitis, then it can go to the stage of end stage liver disease called cirrhosis. Or some patients are increased risk of hepatocellular carcinoma, that is liver cancer also. Why it is called non-alcoholic fatty liver disease? Because these diabetic patients, even though they're not taking any alcohol or taking very less alcohol, but still these people are prone to develop fatty liver. The risk factors are, one is the poorly controlled diabetes, and other is the obesity, and other is the cholesterol problems. So we need to address these issues. As I said, many of these patients will be asymptomatic. Unless you get the scan done, ultrasound scan done, we may not identify. And also there are some advanced tests like fibroscan, we can get it done to see the elasticity or kind of how much fibrosis is there in the liver. And what are the things we need to do to prevent this fatty liver in diabetic patients? One, you should always focus on diet and exercise, because this is the main two pillars to prevention of any metabolic diseases. Diet, in that actually many people think that because if it is a fatty liver you have to restrict the fat. It's actually not true. You need to cut down the carbohydrate and you need to cut down the calorie intake. Then you start doing exercise. Daily you have to go for a 45 to 50 minutes, 45 to 1 hour, 60 minutes of exercise, depends upon your body weight, kind of aerobic activity. Then you have to, if you have a habit of taking alcohol daily basis, then you really have to cut down, because this alcohol also can cause a fatty liver. Then if you have some kind of cholesterol problem, you have to address that also, like you have to be on cholesterol medications. Always discuss with your doctor, because there are many drugs now have come to treat this fatty liver disease or steatohepatitis, especially if you found to have this elevated liver enzymes in your liver function test. So always have a discussion with a doctor and find out what are the options that are available to get treated this condition. And as I said, the primary pillar will be a diet and exercise. So you need to focus very well on this, controlling the calories and going for exercise to prevent this fatty liver disease and these liver complications. Thank you.